What is the difference between UPDRS and MDS-UPDRS? When discussing the differences between the Unified Parkinson's Disease Rating Scale and the Movement Disorder Society Unified Parkinson's Disease Rating Scale, it's essential to understand their purpose and significance. Both scales are tools used to assess the severity and progression of Parkinson's disease. They help healthcare providers, researchers, and patients track symptoms over time and evaluate treatment effectiveness. The original Unified Parkinson's Disease Rating Scale, often referred to as UPDRS, was created to provide a comprehensive measurement of Parkinson's symptoms. It includes various parts, such as assessing mental function, mood, and behavior. It also covers self-evaluation of daily activities like walking, dressing, and eating. Additionally, there is a clinician-scored motor examination and evaluation of therapy complications. The scale also includes sections for staging the disease and rating daily living activities. In contrast, the Movement Disorder Society Unified Parkinson's Disease Rating Scale, or MDS-UPDRS, is a revised version of the original scale. The primary goal of this revision was to enhance the ability to detect and measure both mild and severe symptoms more accurately. The MDS-UPDRS also aimed to simplify the questions, making them easier to understand and ensuring consistency in scoring. One key difference is in scoring consistency. The original UPDRS used a mix of yes or no questions along with a 0 to for rating scale 4 different items. The MDS-UPDRS standardized all items to a consistent 0 to for rating scale. This change makes the scoring more reliable and easier to interpret. Another significant difference is sensitivity to mild symptoms. While the UPDRS was better at identifying severe disabilities, the MDS-UPDRS is designed to detect slight and mild symptoms. This sensitivity is crucial for tracking early changes in Parkinson's disease. Clarity and accessibility are also improved in the MDS-UPDRS. The revised version uses language that is easier to understand, targeting a 7th grade reading level. This makes it more user-friendly for patients and caregivers compared to the original UPDRS, which could be challenging to comprehend. Cultural sensitivity is another aspect where the MDS-UPDRS excels. It focuses more on the patient's experience rather than just the tasks they can or cannot perform. This adaptation helps ensure that the scale is relevant across different cultural contexts. The MDS-UPDRS also specifies whether the patient or a caregiver is answering the questions, which helps ensure more accurate reporting of symptoms. Both scales are used to monitor disease progression and response to treatment. However, the MDS-UPDRS is now recommended by major organizations for use in clinical studies and practice, as it provides a more detailed and consistent assessment. In summary, the MDS-UPDRS is an updated and improved version of the UPDRS. It is more sensitive to early and mild symptoms, easier to understand, and more consistent in its scoring. Both scales are vital tools for managing Parkinson's disease, but the MDS-UPDRS is now considered the gold standard for assessing symptom severity and progression. For individuals living with Parkinson's disease, understanding these scales can enhance communication with healthcare providers about their symptoms and help track changes over time. Always consult a healthcare professional for personalized advice and interpretation of these assessments.